Frequently asked questions regarding bars, restaurants, and other places of public accommodation. Employee illness. Should businesses screen employees for COVID-19 symptoms? You must screen all employees before they enter your business. Please use the Visitor and Employee Health Screening Checklist at this link. This is to screen for COVID-19. You must keep information on employee health confidential in accordance with state and federal law. If staff had close contact with someone with diagnosed or suspected COVID-19, has COVID-19 symptoms, or has tested positive for COVID-19, follow MDH's guidelines for COVID-19 when to return to work at this link. What should businesses do if an employee tests positive for COVID-19? Employers should be aware that employees with a confirmed COVID-19 test or employees with symptoms including fever, cough, shortness of breath, chills, headache, muscle pain, sore throat, or loss of taste or smell must stay home and not report to work. Employers should know that employees must follow MDH's guidelines for when to return to work. To prevent the spread of COVID-19, employees' close contacts need to follow precautions at home and in the community. Retail food and beverage establishments. What types of businesses need to develop a COVID-19 plan? All businesses are required to have a written COVID-19 preparedness plan beginning on June 29, 2020. Do food workers need to wear masks? What if they are not customer-facing? Yes. As of July 25, 2020, people in Minnesota are required to wear a face covering in all indoor businesses and public indoor spaces, per Executive Order 2081. The executive order includes exemptions for people who are unable to wear or tolerate a face covering due to medical or mental health conditions or other reasons. If a worker has a medical condition that prevents them from using a face covering, a face shield that wraps around their face and extends below the chin may be worn instead. Is a face shield required for food workers when they claim that face covering exemption for health reasons? If a food worker claims to be exempt from the face covering requirements, businesses must follow the requirements of applicable laws, including civil rights laws like the Americans with Disability Act and the Minnesota Human Rights Act, that relate to the verification of a worker's condition or disability. The business should also provide any exempt worker an accommodation to the extent possible. For example, if the worker will interact with customers, visitors, or other workers, the employer could offer the worker the option of wearing a face shield as an alternative. As an employer has the obligation to maintain a safe workplace, the business must take steps to prevent the worker from posing a hazard to other workers. If the business is customer-facing, the business should also take steps to prevent an exempt worker from posing a hazard to all customers. Are self-service beverage dispensers allowed in takeout restaurants and in convenience stores? Yes, they are allowed. Encourage operators to minimize this practice if possible and provide guidance on cleaning and disinfecting the high-touch surfaces frequently. According to the Stay Safe guidance for restaurants and bars. Here's the link. Can buffets and salad bars be open? Buffets, salad bars, and other self-service food and beverage stations are allowed as long as the business's COVID-19 plan addresses the necessary customer and staff protections. For example, oversight of the self-service area is necessary to ensure social distancing, hands are being sanitized, and customers are wearing face masks in the self-service area. Queuing area must be marked to provide physical distancing of 6 feet. The best practice is pre-packaging food ahead of time. Can self-service operations in grocery stores and convenience stores stay open? Yes. Customer self-service of salad bars and similar food areas in grocery and convenience stores are allowed. Queuing areas must be marked to provide for physical distancing of 6 feet. For example, by using floor markings, lane lines, and/or marking of adjacent areas where customers may be waiting for service. Can mobile food units still operate? Yes. Mobile food units and seasonal temporary food stands, like food trucks, can operate. Staff must follow social distancing recommendation to keep at least 6 feet apart. So trucks may have to operate with a limited number of staff inside. Encourage online and electronic payment transactions. Local zoning and ordinances may apply. Food trucks must comply with the Stay Safe guidance for restaurants and bars. Here's the link. Are any customers allowed inside of restaurants and coffee shops if they are picking up an order to go? Yes. Customers or guests may be in the establishment to pick up to-go orders for food or beverages, as long as those individuals are at least 6 feet apart from one another while they are on the premise. Drive-through and curbside delivery services are encouraged. Are people allowed to order a drink to consume on site while they wait to take their takeout order? Individuals must make a reservation to consume food or beverage on site and must be seated in an indoor or outdoor seating area that meets requirements. Can restaurants sell meal kits that include raw animal foods? This is allowed, but the retail food establishment should consult with their licensing authority to ensure that the proper precautions are taken to protect the food safety. The licensing authorities should also consult with both the MDH and MDA to ensure the requirements are being met, including labeling as needed. Can food service in long-term care facilities be open? Yes. Long-term care facilities must follow specific federal and state long-term care guidance. Lodging establishments. Can hotels have self-service coffee and water in their lobby? Yes, this is allowed. However, encourage operators to minimize this practice if possible and provide guidance on frequent cleaning and disinfecting of high-touch surfaces according to the Stay Safe guidance for restaurants and bars. Here's the link.